Denise Sakuze Skyze, Hari Sootsen, Travis Holyk, Beast Guy, or I guess in Notley, Beski Sakni. Wagus B. Waniklan J. Notlewaten Habi Yinkot. Hello everyone, I'm Travis Holyk and I'm going to do the presentation on our health services. First slide here is a picture of the team at our annual barbecue. Part of our overall plan is for people to come together and really integrate services, so this is one of the ways that we do that. This slide just gives you an overview of some of the services that we're talking about. Matthew provided his presentation on nursing services, which does integrate with our health services, but overall now Matthew focuses on the nursing services. We focus on mental wellness, which now Marilyn is our Executive Director of Mental Wellness, so she will be presenting on mental wellness next year. We have health promotion and physical activity, substance use and addiction services, primary care services, quality and innovation, and community health. Rhoda isn't here today, but she is now also an executive director, and so my slide deck will be a little bit shorter there as well. First thing that I just wanted to mention is that all of our health services are guided by a health plan. We do a 10-year plan where we complete an evaluation, as well as a lot of community work to determine what our priorities will be in health, and we use that in our negotiations with FNHA around services. And then in between that, we do an evaluation at the 5-year mark, but we also have quarterly chiefs meetings, quarterly community health directors meeting, leadership meetings, community health lead meetings, and surveys in the community that are done by the quality innovation team that you'll see. And really we just try to focus on what are the needs of the community to develop our plan going forward. In terms of our mental wellness program, those are our key programs. So the Addictions Recovery Program, Child and Youth Mental Health, Community Mental Health, and Mental Health Support Services that we provide in the community. Just wanted to share again the number of visits, because sometimes we hear, are people in the community? And the answer is you may not see them, but yes, they absolutely are. So in terms of our overall visits, with over 700 different individuals, it's over 8,000 visits in a year. And then some of the highlights beyond the incredible work that our team does throughout the year, they also off the side of their desk often take on additional work like the Strength and Solidarity all-male event in Sycas. We will be focusing on a lot of men's service delivery, and so this highlights some of the work that we're already doing in that area. The I Am Women's event in Stellatan, so focused on female wellness, and also because we don't have Tatchik Lake, another big thing that our team does is the Ormond Lake Camp each year. Another thing that Maryland has done that I think is really something that we're proud of is the ATSU program, soon to also be the ATSN program, but the ATSU program is growing, and so now in its 3rd year of operation, again, it's a focus on the strengths of the community in uplifting the community. Not necessarily does somebody always need a clinician, sometimes they just need that grandma or aunt, and so again, kind of focusing on culture. And then another important thing that we do is both the land-based activities, but also things like the community fire, where again, it's not kind of set in a clinical setting, is taking people out on the land and just providing those healing services at a community level near healing fires and places that hold a little more meaning to community. As I mentioned, Tatchik Lake isn't up and running yet, so we pivoted and with our substance use and addiction team, led by our clinical director of substance use and addiction, Tracy Day, we've still been providing withdrawal management, or what some people call medical detox, at Tatchik Lake. The plan for this year will be that because we know that Tatchik Lake is probably still about a year away, is we hope to do not only services at Ormond Lake, but actually focus on the community. So for community leadership here, if you have space in community, I know that space is tight, but maybe looking at having medical detox directly in the community. So something that we're trying to put together for this year. And this just gives you some idea of the numbers in terms of services around medical detox that we've been able to provide at Tatchik Lake. So close to 59 individuals in the last couple of years. Again, it seems with our men's wellness focus, you can see here as well that it's women more often that are accessing the service than men. And so some of the things that we want to focus on is services for men. We know that they need the services. We've heard a lot of kind of anecdotal information that men aren't accessing services, and we see that both in the numbers in things like this. So we want to meet men where they're at with services. This particular program came out of some of that evaluation and kind of need in community. So what we heard in our last evaluation is really that we needed to focus more on health promotion, physical activity, and diet and exercise. So Amy's team is a growing team and a new service. And just from the ring of pictures that you'll see in the next 3 slides, they do a lot of good work in the community that I think really pairs well with some of our mental wellness services in terms of really kind of building that support in the community, but also getting people more active, which again improves mental wellness. So we also, as part of what we will be doing, we will be hiring a dietitian as well as an additional physiotherapist. Our current physiotherapist, Mac, is pretty busy, and we don't get enough service to Takla in Yakuche in particular, so we want to expand that service. And the dietitian is also part of our need for Tatchik Lake around ensuring that menus, etc., meet the needs of clients, because that's part of our accreditation. So some of the highlights from that program, again, in partnership with UBC and others, we did some arthritis support work, we did some fall prevention work, and then just getting kids out and trying different sports. Learn to Skate has been one of our highlights, and the hockey tournament has been, was on hiatus, but thanks to Amy's team, it's back, and it will be back again. I think it's the weekend of March 6th this year. Amy's given me the thumbs up, so I got that correct. Yay for me. And then other things that have been taking place, the elders yoga, as well as some of the strong women, strong community work that's been going on. So again, really targeted services to all ages of the population, which really kind of meets our mandate around the life cycle. And another slide just to show that we are tracking the impact of services, so number of individuals involved. And in the Learn to Skate, it's pretty cool that there's over 108 people who have been involved. And the other camps you can see. And I also should mention that a lot of these events are either in partnership with research, so a lot of the work that we did with elders, as well as the soccer camp, which is a partnership with Foundry. So a lot of kind of cross-pollination. We talked about like that integration of services across our teams, and Amy is definitely one of the ones that her team is really working in partnership, as well as like the women's event that's a partnership with mental health and others. So congrats on that. Oh, we got some applause for that. Amy, did you like say, please, like, always looking for that positive reinforcement. Well done. Another one of our flagship programs is our primary care services. Always a growing team, so 13 family physicians, 8 medical office assistants, 4 nurse practitioners, 3 registered nurses, and 2 social workers. In addition to this, I think we have about 8 specialists as well, and I'll get to another slide on that. But in terms of, we also provide a lot of specialist support, and I do have a slide on the heart health work that's being done, which is actually in Notley today, was in Yakuche and Takla last week, and will be in the Burns Lake area for the remainder of the week. So our primary care team, this does include some of our nursing services as well, but we have over 44,000 encounters. This includes chart notes and other things that the physicians and the nursing team does, in addition to like home visits, telehealth, etc. And this just breaks it out a little bit differently in terms of our NPs, our RNs, and our physicians. So in-person visits, over 5,000 from our physicians, over 5,000 from our nurses, and our NPs are close to 2,000. As well as, like you can see, their home visits and other things, so meeting people where they need the services. And then other data that we track is really what's going on in terms of conditions. And that, again, this also lines up with the evaluation where people talked about the need for heart health. And so really proud of the work that we've done around bringing specialists to community. Dr. Miles is here in Notley today along with Dr. John. So partnering with our physicians to make sure people get the care that they need. Again, you can see because of our focus on heart health, diabetes, mental health, having teams, and then respiratory, Dr. Pat Camp, we've been working with for a number of years, bringing spirometry directly to the community. So you can see that those are some of the conditions that we're seeing a lot more people. You can also see on the slide beside it, cardiology, we're getting a large number of visits in the community with Dr. Miles's team. And this is just a breakdown of individuals seen and also by age. So another thing that we are keeping track of is by age, what are people accessing care for? And you can see kind of across the board, mental health is one of the things that's being seen regardless of age. And then we can kind of determine what the needs are by age group. So the opioid agonist therapy around ages 20 to 29, we're also seeing that as a population that we need to do more work that will tie into the men's wellness. I know Marilyn talked about in the community, there's that group that kind of is lost and kind of we really need to provide services to. So we have the data to support the work that we're doing. I'll also mention that in terms of prescription medications, when I presented last year, there was a question about traditional medicines and services that we're providing in that area. So based on that feedback that we got from the AGA last year, we've started to track the number of traditional medicines that some of the healers that we have are providing and so that's something new for this year that we'll track, and so I would think that stat will also grow as we find different ways to collect that information about people accessing traditional medicines. I wanted to mention Travis, who passed away recently in relation to the Foundry, because he was one of our leadership committee members and always attended all the meetings. And so definitely sad that Travis passed away so suddenly. Really, we thank him in the work that he did with the Foundry in particular. I know like a strong board member as well, but just in terms of the Foundry, was always there for meetings and things. So we wanted to acknowledge him. So excited about the work that we are doing in Foundry, particularly Burns Lake, which will be opening in October. More opening, I would say, in November, but grand opening in October and soft opening in October when we can kind of work out some of our service delivery plan. Again, it's for ages 12 to 24, really needed in the Burns Lake area, and I think it was probably close to 6 years ago, as Chicky said at a board meeting, you should apply for this. We did, and through COVID and just like construction and everything else, we're proud to report that that will be open. So very exciting, and congrats to Randy and Katie, and well, two Katies now. So Katie Nesbitt is our manager of the Foundry in Burns Lake, and other Katie, Katie Cornish is overseeing the build that's going on in Vanderhoof. And what we do plan is a corridor of services. So for here in Notley, it will be that there will be some satellite services that we're able to provide by having those kind of posts between Burns Lake and Vanderhoof. And again, this is what the site looked like when we first started. It took us a long time to determine an appropriate site in the Burns Lake area. There was nothing that we could just move into. And so in partnership with the school district, we were able to secure the land of what was called the bus garage, and we turned that bus garage into this building that you see. And so we're quite proud of that. It looks beautiful. Randy keeps saying it's not only the most beautiful building in Burns Lake, it's the most beautiful Karisakani building. Did I offend anyone else with that? Oh, Warren, yeah, Tachik Lake will be beautiful too. Rhoda wanted me to highlight some of the work that's being done in Jordan's Principle, and even some of the shifts since ISK has kind of tightened some of their rules around Jordan's Principle. So you can see out of 783 individual applications submitted, only 241 have been approved. So there's still 511 that are in the queue. So definitely things have slowed down in terms of approvals at the ISK level, and I know Rhoda and Warner are really advocating for these much needed services for children. This just shows it another way. So in the fiscal year 24-25, we're seeing a decrease in the number of approvals, and so 23-24, it was 1.7 million, so a $700,000 reduction. And in terms of the services that are being approved, it's mostly health supports off reserve. You can see like that's a large portion of that, the ones that were approved. And of course, all the slides that I'm providing here are actually because of the work that we do around quality and innovation. So Rachel's team leading out that work. So they do all of our statistics as well as our evaluations, and are instrumental in our accreditation program. I'm pleased to announce that we were audited this year, and we received our 3-year accreditation, which is the highest level that you can receive. And so kudos to Rachel and her team. Again, evaluations and community needs assessment. So all of the work that you're seeing kind of throughout the organization, whether it's jurisdiction, whether it's Tachik Lake, we've completed a number of evaluations, and Rachel's team will also be doing the community needs assessment that's integral to jurisdiction work. And so all of that is led out of our teams. Oh, I guess the last one too, if you ever want to do research, I know this is being broadcast as well, we now have a number of resources. So we have applied for our recognition through the Tri-Council Agency, which is the big funding body in Canada. And so we've revamped all of our policies to make sure that they're in line. And so we hope to, at some point, be able to apply for grants on our own without needing universities. Of course, we would still partner with them, but where CSFS would lead some of that work. We do have our own ethics team as well that reviews grant applications that are specific to CSFS, but always willing to partner with communities as well to support that work. As we do with all of our services, we're here to support the community. And as part of our research team, I also want to acknowledge Jim Williams, Justine, who also passed away this year. From the beginning of the work that we did, Jim has been instrumental. He always called me his Nidoska. And so it was sad to see the passing of Jim from the get-go, kind of instrumental in teaching me DAC health. So sad to see Jim pass. We have a number of projects on the go, but I just wanted to highlight this one because we are in the wrap-up process for it. And so Strength for All, our elders' suicide, has really been around the grant cycle since 2006 when we applied for our youth suicide intervention project that then moved to adults and has now moved to elders. So Bianca has done a lot of work with the elders around traditional activities, just going and visiting elders, doing different things that the communities determined were needed in terms of supporting elders with their mental wellness. And a lot of positive feedback. Again, some partnerships with Amy's team around getting elders out and active. And one of the strengths of CSFS is that even within a research project, Dana was able to continue the work that we were doing in CICAs because the work was going so well and was much needed. And I see Ted was here, was part of that group as well, and a lot of positive feedback in the work that we did. We're at the stage where we're writing it all up, and so you can see we've been collecting all of our data. The data for the youth services really helped us to write a lot of proposals, so the data collection is always important because we can then show the impact of the services. So when we did the canoe journeys, we were able to show the positive impacts that it actually had on youth, both in the surveys that we did, but also the qualitative interviews with youth. I'll also mention this, we are working on a book. This was something from our advisory committee that they said, we really want to highlight the strengths in the community, and so as part of the project, they wanted a book that highlights the strength of our elders. And so that book is in process, and we also are developing manuals around suicide. We've completed our youth and our adult. We're working on an elders manual, and we see this as being part of the compendium of things that we'll be able to provide so that if somebody is facilitating a workshop around suicide, this would be one of the pieces that they could use to kind of talk about the strength or even specific to their community around elders' knowledge. And so that will be done, I think, by November. The book, yeah, thumbs up again. Hold on, 2 for 2. And I should also mention that next September, as part of all of the wrapping up of this work, and also a call, I think, from a number of people, there was the request that we have the elders gathering. I think Chief Maureen, you also mentioned that last week. And so we will be having a big elders gathering again in September, where some of these materials will launch in a good way, but also do a number of events for elders at that event. I'm in the home stretch and just wanted to mention Pauline and the work that she does around advocacy. So within our department, if people are having challenges accessing either CSFS or Northern Health Services, Pauline is there to support that work and try to resolve some of the issues that people may be having in accessing services. One of the important reasons to mention it is that, as you can see, a lot of the work that Pauline's doing right now is focused on TACLA, so just wanted to let other communities know that her services are available and she can provide that advocacy. And then this just shows some of the services that Pauline is providing. Typically it's around medical transportation as one of our main, but also in accessing housing, food, primary care, or medical planning. She can do all of that work as well. And then at the hospital, Miss Dorothy Williams, who is a tireless advocate for individuals at the hospital. It says there on average, Dorothy supports over 10 patients per day, but I would also add, even in speaking to my wife, who sees Dorothy on a regular basis, she's also working with the nurses and the teams at the hospital to make sure that services are much more culturally appropriate. And so, again, a fluent speaker, and so compassionate. We really are grateful for the work that she's doing at the hospital. I have the first slide there just to show that was when I presented at the AGA last year. Those were some of the things that I said were up and coming. And we've pretty much done a lot of them. So Foundry Burns Lake is open. Maryland's grown the ATSU program. We did sign an agreement with FNHA. That agreement is coming back up for renewal. And so we'll be working with them on that, but it did provide some stability in terms of funding. And we've developed all the HR plans that we mentioned there. And then on the capital and infrastructure for this year, Foundry, we will be doing the planning for that. We've got the community needs assessment for that up and running. Hopefully with the Healing Center we'll be up and running soon, but we continue to do the capital planning for it. And another big piece of work that we'll be doing this year is improving the idea that we will be a center of excellence. And so that'll be working on training and other things that we'll provide out of the center, as well as research and evaluation, so that we're leaders in the North in addiction services. Again, something to be negotiated with FNHA is a memorandum of understanding, as well as a new funding agreement. Maryland has been working on a summer student program that we'll be implementing this year. So in all of the health programs, we will have summer students. I mentioned that we'll be working on men's wellness, and we'll be working around reporting to the communities, but in the way that the communities can access their data as well. And so this is just to give you an example. At some point, this we hope will be on our website or other places where individuals can then go in and look at health data specific to their communities. So that is also in the works. Another big thing that we've been working on that Warner has directed us is around chronic disease management. And so one of the areas that we've been focusing on is cardiodiagnostics. And so you can see from this slide, the tour is going on right now. And as of last week, I guess, and CICA's this week, we've already had 70 consults with 53 echograms completed and 43 stress tests. And so a lot of heart health work going on in the community. And then in terms of other chronic diseases, we've been working with physicians or specialists on an osteoporosis project around increasing awareness and developing a plan for fracture risk. And we've been working around kidney health. So our goal is to work with community to define a kidney health strategy. Before questions, we also, my team sometimes throws me curveballs and says, also we have a video to show. So with GLOW funding, again, outside of regular funding, we also sometimes access funding. We've placed a real emphasis on STI screening. And so the video that they wanted to show is around HIV and breaking stigma. So the work that we've been doing. So building trust and connection in the community, and there will be ongoing events in the community. So talk to Katie Cornish and Randy if you have ideas for events that you want to see around HIV. And with that, we'll show the video.
My name is Cole Mueller, and I'm a registered nurse with Cares County Family Services. The best way that we can be allies for people living with HIV is to help break down and address kind of barriers and stigma whenever we can. And that might not just be barriers, beliefs, or stigmas that we hold, but it's when we encounter them. And so working with others to help broaden their understanding or to challenge those beliefs when you encounter them, I think can be a big way that we can be an ally to individuals living with HIV. Stigma is a series of beliefs that are held that may or may not be based on fact, fiction, or otherwise, and guide either behaviors, interactions, or experiences for individuals both that hold those stigmas and those that live within those stigmas. HIV doesn't discriminate, and so it can affect anybody. It can be unexpected. I mean, you might not assume that someone has it, and it can be there. Day to day, people still do experience a lot of stigma and a lot of fear around living with HIV. There's a lot of inaccurate beliefs about how that infection might be transmitted to other people, which can lead people to be fearful around that person. Ultimately, stigma can be very harmful and dangerous when not addressed because it leads to beliefs that are not based in fact or reality, but that end up guiding people's interactions, behaviors. I mean, it can lead to harmful or hateful behaviors towards others that they perceive as different or wrong based on that stigma that's held within them. Living with HIV in this current day and age is definitely manageable. Like, individuals do live those long, healthy lifestyles. It does still represent a pretty big burden for individuals having to maintain those daily medications and those regular blood tests, and there is always risk of infection, especially when an individual doesn't know their HIV status. Knowing your health status has never been easier. You can engage with any of the Cares County Family Services clinics where you can get either a point of care test, which looks like a finger poke, a little bit of blood's drawn from your finger, and you'll know right then and there within a few minutes what your HIV and syphilis status is. You can also get a blood test where blood's drawn from your arm, sent away to a lab, and within a period of about a week, you'll know your health status for HIV, syphilis, hepatitis. Ultimately, it just involves connecting with whatever healthcare provider you have most accessible to you and kind of initiating that conversation. You are not in this alone. If you require mental health support at any time during this process, we recommend you contact these services: CSFS Mental Health and Wellness Services, Positive Living North, or visit the Crisis Center for the North.